Hi, I'm Dr. Ellen Wilson, Associate Professor of Obstetrics and Gynecology and Reproductive Endocrinology at UT Southwestern Medical Center in Dallas, Texas, and I'm happy to be answering questions today for HysterSisters. Do I still need a yearly checkup after hysterectomy? A yearly checkup with a gynecologist is recommended even if someone has had a hysterectomy because an annual checkup includes a general health screening, including breast examination. A yearly mammogram is highly recommended for all women starting at the age of 40 and may be recommended prior to the age of 40 if a patient has a family history of breast cancer or breast abnormality on physical exam. A pelvic exam is important, especially if a woman still has a cervix and certainly if there are complaints of vaginal dryness, irritation, or discharge. Yearly blood work is advised, although often a primary care physician, such as a family practitioner or internist, may be doing these. Your gynecologist or internist can guide you as to the best age to go for a bone density test, a colonoscopy procedure, or any other such screening test that you may need. Do I need a pap smear after hysterectomy? A pap smear is an important screening test for the early detection of cervical cancer. In general, a pap smear is not recommended by the American College of OBGYNs after a total hysterectomy when the uterus and cervix are removed. However, there are some exceptions to this rule. If a partial hysterectomy was done, that is, the uterus was removed but the neck of the uterus, which is the cervix, remains, then pap smears should be continued. Or if a total hysterectomy was done for cervical cancer or precancerous condition, regular pap smears continue after hysterectomy. And some physicians still perform pap smears every few years during the annual exam. Since my hysterectomy and oophorectomy, I struggle with my weight. Can you help? Weight gain is sometimes reported after hysterectomy, with or without the ovaries removed, and the mechanism is not entirely understood. The recovery period after hysterectomy can last up to 10 to 12 weeks, depending on the type of procedure used, and the lack of physical activity during that time can lead to some extra weight if food intake is not decreased. For example, if you're hungry, try to snack on vegetables like carrots and celery or fruits like apples, which are high in nutrients but low in calories, instead of snacking on chips and crackers, which are usually higher in salt, fat, and calories as well. Post-hysterectomy weight gain can be avoided through attention to diet and exercise. I want to live a lifestyle of wellness. Where do I start? Regular exercise has a number of health benefits, including decreasing the risk of heart disease, improving mood, energy, and promoting better sleep. In addition, it can help with a weight loss program, and it's good for preventing bone loss and decreases the risk of osteoporosis. Ideally, everyone should be getting at least 30 minutes of physical activity every day. It's important to keep really well hydrated during the day, and depending on the type of activity you're doing, everyone should aim for at least 8 to 10 glasses of fluids every day. And it's important to eat a good diet with a large variety of fruits and vegetables and plenty of protein. I would advise avoiding things like sodas and most processed foods, which contain a lot of sugar, salt, and fat. And try to get 7 to 8 hours of sleep every night. And above all, don't smoke. And if you do smoke, quit. And lastly, stress reduction is key to our health and well-being. We live in a very fast-paced, stressful environment. And it's important to take a step back on a regular basis and relax, whether that be through exercise, meditation, yoga, or for some it's listening to music or going to a fun social event.